Hi, my name is Tiera and today I'll be discussing pressure ulcers. The first thing I'll be discussing is the Braden scale. The Braden scale is used to determine the risk of a person developing an ulcer. So there are 6 different categories, and each category is either, most of them is up to 4. So 1 through 4, and the only one that's up to 3 is friction and shear. So the first one, if you stage on 1, that means that they have an impairment, they have an issue in that category. And if you go up to 4 or 3, they do not, which means that they score the highest. So some of the categories, like I said, is friction and shear, nutrition, moisture, activity, sensory perception, and also mobility. So as I talk about the Braden scale, I will also talk about the ulcers. So stage 1 means that there is no issue with the epidermis being broken. Stage 2 is partial thickness, which means that the epidermis is broken. Stage 3 is full thickness, that means the epidermis and the dermis is broken. And then if you go to stage 4, that means the epidermis, the dermis, and also the subcutaneous tissue is also broken, and with a possibility of bone exposure. And then the unstageable stage is when you see necrosis or when you see eschar, and it's unstageable because you cannot see under it, so it will have to be broken for you to stage it. I have a picture here that I would use to stage a picture of it, since I don't have an ulcer to stage. This one, as you can see right here, the epidermis is broken. So this is why this will be considered a stage 2, because the dermis is broken. But that is ulcers. Thank you. Hi, my name is Tiera and I'll be performing ostomy care. First thing I would do, I would check the physician's orders, making sure that it is time for ostomy care. Then I'll go and introduce myself, ask for the name, date of birth, make sure I have the correct patient, and then I will go ahead and start ostomy care. And then first I would do is put on my gloves, wash hands and put on my gloves. And then once I've put on my gloves, I'm going to remove the old pouch and the wafer and throw it away in the biohazard bag. Once I do that, I'm going to assess the stoma, making sure there's no signs of infection, no bloody drainage or anything abnormal on the stoma. And then after that, I am going to take a warm washcloth and clean it. I will go around it and making sure I get anything that does not belong, and then I'm going to pat dry after. After I do that, I will go ahead and wash my hands, put on new gloves, and then I'm going to put on a new pouch. First thing I'm gonna do, I'm making sure it fits. So I will measure it, and then I will, this one is too big, obviously. This one has a little bit more space, but this one is just right. And if there isn't one, I will cut one out. This one is cut into the size that was just right. So I would place it on top. Then I would go ahead, that's the wafer, and put the bag on top of it. Take the adhesive off the bag and firmly press. And then I'm going to make sure the end is closed completely to make sure that no fecal matter comes out when the patient goes. So after that, I'm going to wash my hands, take off my gloves again, and document what I observe, an assessment of cleaning, making sure no infection, making sure the drainage. I want to check the color, odor, consistency, and amount for coca, and then document how the patient tolerated the procedure, and that is ostomy care. Now next I'll be discussing the types of bandages and dressings. The bandages and dressings are used to protect the wound from contamination and to also improve the healing in the wound. So you can have like a transparent or non-transparent, transparent, to determine basically if you want to see the wound or if you're okay with not seeing through the bandage. Then you have sterile, non-sterile based on the type of wound that you're trying to heal. Then you also have the different forms. It comes in the rolls, pads, and also sponges. And mainly they use types like the hydrocorticoid dressing, the hydrogel, and the L-generate dressing. And going to the types of drainage systems in the ostomy, there is the ileostomy, diversion from the ileum into the small intestine or the abdominal wall. Then you have the coleostomy, which is diversion from the colon into the abdominal wall. And then lastly, you have the urostomy, which is the diversion from a urinary bladder to expel urine in a different area. And that is ostomy of wound care. Hi, my name is Tiera Bridges, and I'll be performing dry dressing change. First, I'll verify physician's orders to make sure that it's okay to perform the dry dressing change. I will go in the room and identify patient by asking a name, date of birth, and make sure I have all my equipment gathered. The first thing I would do, I will first perform hand hygiene by washing my hands and then putting on gloves. And after I perform hand hygiene and put on gloves, I would then go ahead and remove the old dressing. And this is the old dressing. Okay, so this is my wound right here. I will go ahead and wash my hands again and perform hand hygiene and put on clean gloves. And if I needed sterile gloves for a sterile dressing change, I would use that. So first thing, after I have on new gloves, I will go ahead and put some sterile water in here. And so when I clean, I can dip the gauze in and wipe around. So first thing, I would dip it into the sterile water and wipe, going from the most contaminated to the least contaminated to the most contaminated. And I would do that and use a different one for each side. Okay, and then I will go ahead and use something to dry it the same manner, going from the least contaminated to the most contaminated if I needed to wipe more of the area. After that, I have my 4 areas taped already on the side. So then I will use the new dressing to put on top and tape it on 4 sides. Okay, and now that I got it taped, I will go ahead and remove my gloves and wash my hands again. Then I would document what I would see, if it was a lot of blood drainage on the dressing that I changed, and I'll put on how the patient tolerated it. And this is my dry dressing change.